Welcome, everyone, to the Mesothelioma Guide podcast, a regular offering on the Mesothelioma Guide website, where we interview doctors, researchers, survivors, and experts on the latest trends in mesothelioma therapies, their experiences working to help people with mesothelioma, and more. In today's episode, we have with us the most knowledgeable person I know, in my opinion, when it comes to mesothelioma. She has answered probably about 2,000 of my questions since I've known her, and is still the first person I go to whenever I have a question. She is the most valuable resource for any person or patient affected by mesothelioma. Jenna Campagna, the lead patient advocate and registered nurse for Mesothelioma Guide, thank you so much for joining me today.
Hi, Devin. Thank you so much for having me, and thank you for those kind words. I am very glad to be a part of the Mesothelioma Guide podcast, and I'm excited to chat with you today.
Awesome. So, I gave my introduction, my personal one, but if you can kind of give the brief explanation to me and the listeners about your medical background and how that led you to helping people affected by mesothelioma.
Sure. I have been a nurse for over 10 years. I started out in pediatrics, specifically with the special needs population, as well as children with rare cancers, rare childhood diseases, and chromosomal abnormalities. So I've always kind of been intrigued by the unique medical diagnoses out there. I too have struggled growing up with a parasitic disease that no one knew about. So I had to travel to multiple doctors for assistance with treatment. So it wasn't until we moved to Florida from New Jersey that I was kind of able to start something new. And I was looking for that nurse navigator, patient advocate role here, and I stumbled upon being a mesothelioma patient advocate for Mesothelioma Guide. So I've been here for over 5 years now. And I absolutely love what I do, helping patients, guiding them through the craziness kind of the healthcare system is really, I feel, a benefit to them that I can, give them. I know sometimes doctors and nurses at, offices either don't have the time to kind of give people exactly what they need. So I'm happy that I can be that resource now.
What are the specifics of being a patient advocate and a registered nurse for Mesothelioma Guide? What does that day to day, or even honestly, even hour to hour look like specifically for helping people affected by this cancer?
Sure. I feel like so much goes into it.
We could probably spend a whole podcast doing that. Yeah.
Exactly. A large part of my day-to-day is making sure that I'm knowledgeable about everything there is to know about mesothelioma when I'm, not helping patients. Patients either come to the website and, fill out forms needing information either on the diagnosis, treatment options, or getting connected to a specialist, or they, live chat me and ask me questions and get answers instantly. I think that's an awesome feature, that we have here at Mesothelioma Guide. I get emails, people will read a blog or a page and find my contact information, send that out to me. I feel like I'm talking about so much right now. But a big part of my day is answering questions. Like you said, I know you've had a ton of questions to get to become, a subject matter expert on mesothelioma. I also try to, reach out to specialists to learn exactly what they are looking for. So when patients need to get connected to a doctor, I can learn more about their diagnosis and let them know which doctor I feel would be best suited for them. I am a huge support system, I guess, for a lot of patients and family members just to talk to, or at least, run things by. A lot of people will go to their doctor's appointments and then call me up and say, okay, the doctor said this, this, and this. What do you think? What do you feel? We don't necessarily give medical advice, but we do try to educate, as much as we can so that patients and family members can make those difficult decisions, and have some peace of mind. So not only focusing on the medical side of things by educating people on, right, their treatment options, their diagnosis, but on that, psychosocial, emotional side of a cancer diagnosis as well. On top of that, I feel I also sometimes give advice on nutrition, support group, travel grants. I know finances can sometimes, come into play, especially if somebody does not have a specialist local to them. They are afraid either to travel or are afraid of the expenses that may come out of that. But I spend a lot of my time looking for organizations that offer grants or assistance for mesothelioma patients. So I do have connections with that as well.
You've touched on so much and so many different aspects of being a patient advocate. And I imagine if you didn't have that help and didn't have that expert guidance, your expert guidance, and you're trying to go through all these different processes, finding treatment, knowing, finding a doctor, finding a cancer center, just in general how to respond, it has to be, I mean,
it's very daunting for most people.
exactly. So is a question, do you oftentimes get people coming to you kind of with their hands in the air saying, what do I do? I don't know what to do. Please help.
Yep. I don't know where to begin. I don't know what to do. Or that, just hearing the word cancer or hearing incurable, right, for most of these people, because this cancer does tend to be extremely aggressive, right, and spreads quickly most of the time. Everything someone reads on the internet says, a prognosis that isn't very hopeful. So sure, I feel people almost get stuck in their tracks, right? They don't know what the first thing is they should do. Mm-hmm. So I hope to be that person that can kind of simplify, the next steps to take without bombarding them with too much info, because I also don't want to, overwhelm them with what to do. I will, I did speak about all of the things that I can offer or assist with, but I do take my time, with all that. And I try to listen and really try to figure out what that patient needs or that family member needs most immediately, and then kind of go from there.
What are some of the common questions and concerns that you get as you're providing support to patients? I imagine the first question is, what do I do? As you go along the pathway to help them get treatment, travel grants, probably a lot of healthcare questions, health insurance questions maybe, but what are some of the questions it seems like you get a lot of the times that maybe you can give some answers to right now for the people listening, kind of giving them a bit of a head start? I don't know if there are a few that kind of stick out.
Yeah, I think you hit the nail on the head with the first one with our convo just, a few minutes ago by saying, where do I begin? I usually tell people, kind of to take a deep breath, that, I will hold their hand through this process. Initially, I think the best course of action is to either get a second opinion or get connected to a specialist right away if their doctor feels that the diagnosis is accurate. A lot of times I get asked, do I need a second opinion? Should that be, the first step? And I always say yes. Mesothelioma being a rare cancer, a lot of pathologists, especially if they're younger, may not have seen this cancer underneath the microscope, right? So it could be that it was misdiagnosed, or that maybe they didn't use, the immunohistochemistry that they were supposed to use, and maybe a cell type wasn't offered, and just, they said, okay, it was malignant mesothelioma, but there's no histology associated. So I will either recommend, right, go see a specialist or get a second opinion from that biopsy. A lot of patients don't realize that that's an option. You can have your biopsy slides be sent to a different pathology lab. For example, Brigham and Women's, which has one of the best, I think, mesothelioma programs in the country, will accept biopsy slides from a different institution to help confirm the diagnosis. So once we have a definitive diagnosis, then it's getting to a specialist. So that's a big question that I get often. Another kind of, scary question that I get this asked all the time is that people read statistics and they say, oh, my, family member was just diagnosed and I see they only have 6 months to live. Or a local oncologist who doesn't know much about mesothelioma says, get your affairs in order and, there's nothing we can do for you. So I think it's hard for me to impress upon somebody that they shouldn't focus on the statistics. I think I've said that to you quite a few times too.
Absolutely.
It's hard not to when you want black and white answers, right? I think this is a type of cancer that is so highly individualized that it is really hard to give an exact answer of a prognosis or, of a life expectancy for somebody who is diagnosed. Now, we know with the little research that's been done that women tend to have a better prognosis than men because they tend to be diagnosed at an earlier age. Younger patients tend to do better with surgery because maybe their bodies are a little bit healthier and stronger than somebody that's, of older age. So that's a big question. It's a hard one, honestly, for me to answer because people want answers.
Mm-hmm.
And me saying, it's very individualized. Some studies show this, some studies show that. I don't want you focusing on that, 6 months to a year, prognoses that's out there. I want you to focus more on what we can do to extend prognosis and the quality of life. I'm a big proponent of having people feel comfortable as comfortable as they can, with the cancer diagnosis. This cancer also tends to be pretty painful. So, having a pain management system in place to help with quality of life is big.
Well, I think touching on the survival and prognosis, what you said kind of gets a light bulb in my head thinking, you could be a stage 1, stage 2 patient in your 50s or 40s, and this is all hypothetical, what I'm outlining here, but you see 6 months to a year as a statistic for survival, and that might not be accurate for you because that person, you might be healthier and have less advanced cancer, and all of a sudden, that person has all these red flags and the fear of the stats they are seeing. Like you said in your role and how we can extend prognosis, you're helping them connect with the best support resources, the best treatment, the best centers, the best doctors. Just going through that process seems like it has such a high potential to increase the ceiling of someone's prognosis. These stats we often read about are based on a lot of patients who didn't seek an expert and didn't seek your help and didn't go to one of the top cancer centers. So it's kind of like, yeah, you're seeing these stats, but by reaching out to you, and I say me as in you, reaching out to you, Jenna, to us at Mesothelioma Guide, you're already taking a step to make sure your prognosis is a little bit better, right?
I love that you said that. Yes, you're advocating for yourself or for your family member or loved one, and realizing that, hey, I'm not going to maybe accept what the local oncologist said to me. And, I want to know that I can do more, with this diagnosis. And you also, I want to touch upon, you brought up a good point. Since meso is so rare, a lot of these studies, right, have patients from their 30s to their 80s. So it's the combination of everyone in there. So that's why I say, and we're taking the average of that to give you, a survival rate, for example. But right, if you're in your 40s and you're diagnosed with stage 1, that doesn't really apply to you, because those survival rates include either people that might not have sought out treatment, somebody that is a lot older with more comorbidities, for example. So I like that you brought that up. Thank you. It's a good thing to point out.
For sure.
For sure.
How often are you communicating with patients who reach out and seek help from you? Is it every day? Is it once a week? I imagine the real answer is a case-by-case basis, but...
What does it look like?
Yeah.
For some families, I am in contact, almost 24/7. I do remember a few years ago, I had a family. The mother was diagnosed with mesothelioma, and she had 2 daughters, and I was in constant contact with the 2 daughters. And, nights, weekends, it didn't matter what time, if I could be there to answer a question or let them know that they're on the right track, validate exactly what they're doing, then I'm, was fortunate enough to be there for them, as that support system. Some people want more time to decompress and do things on their own after I provide them with information, and that's great. I'll try to do a follow-up, every couple of days or a week even. I kind of judge this by how the other person feels. I don't want to bombard people if they're not open to communicating often, but I want to respect, what they're feeling, I guess, basically. But I try to be readily available for anyone, at all times.
I imagine it has to be such a comfort because it's tough for patients. These questions, these thoughts and fears don't always pop up between the hours of 9 and 5, when in theory they could contact their doctors. So having someone who, like you said, it might be all hours of the night when they're available. I know that there's probably a limit to that, but having someone there to answer a question at 6:30 in the evening or 7:30 in the morning, that has to be such a huge resource and a huge comfort for people.
For sure. I wish, and I understand, and I'm sure you can understand why some doctors do not give out their cell phone, because
Yeah.
I feel like there will always be some people that do take advantage of that, But you're right. Questions don't always fall in the time frame of when somebody's at work, and you may something may pop into your head at 10 o'clock at night, and you don't want to forget it, so somebody may text me, and yes, I may be sleeping, and then get to them early in the morning when I wake up. But it is nice, and I hope I can be that resource for people when they can't get in touch with their doctor or the nurse at their doctor's office.
This next question might be a difficult one to answer. Is the job emotionally taxing for you?
So this is a really good question. Being a nurse, yes, in some regard, I do get emotionally attached to people, especially if someone is very emotional with me on the phone. A lot of times, honestly, I'll cry with them. Crying is such a release and an outlet. I am a human. I have feelings. As a nurse, we do build up, a tolerance. That may not be the best word to use, but, we do need to have some thick skin, because we don't want to get, frustrated or debilitated in what we do, right? We want to be able to push through and be that rock and that support for people. But I can tell you that there have been days, that I've stopped work and, been pretty upset or, cried about a patient or a family that maybe has lost a loved one due to me. So, or just, I feel I'm a very empathetic person. So I do take on a lot of people's feelings, and sometimes the frustrations of a cancer diagnosis I take those on too by people telling me, hey, my dad is, very angry and lashing out and, doesn't want to do this, doesn't want to take his meds, doesn't want to do anything to help him. I definitely feel that, but I try my hardest to still educate people and letting them know, hey, there are so many different emotions that somebody's going to go through with a cancer diagnosis. And so that way, for me too, it reminds me, hey, I'm human, I may feel stuff, but I want to have, enough strength to be there for other people.
That thing you said about having thick skin, it's so true because, you may have a patient or someone whom you're working with and talking to, and it's getting to you. Maybe it could be any different aspect of their diagnosis and their journey and their cancer fight that you're going along with them, and it's difficult for you, but you also have to be able to also help these other people, not just this person. So you have to be able to have that thick skin and be there for all these other people. Is that something, and you had the medical background before coming to Mesothelioma Guide as a patient advocate and registered nurse, you had that medical background, but is this something, have that thick skin, is that something that came naturally, or is that something that you kind of had to grow into?
Starting off as a new nurse, yeah, I wasn't the best at this, especially working, in pediatrics with children that I knew, had poor prognoses, and seeing, children pass away and what it does to a family, that really took, I have goosebumps actually now talking about it. That certainly, was extremely difficult. I have had to myself, practice a lot of mindfulness, go to, talk therapy. That certainly helps for first responders or nurses or doctors so that we can, like you said, still be there for other patients, so we don't get stopped in our tracks and not move forward, because this is why we're in this profession, to be there for other people and help other people. With COVID, I was going to say before, I think this has been one of the most challenging times, not only for nurses and doctors, but mostly for patients and families, because if somebody's going to the hospital now, Devin, they may not be able to have a family member with them due to the COVID restrictions. I can tell you, we did have a patient a couple of months ago during the height of COVID that was in the hospital, and his wife, didn't see him for 2 weeks. So I couldn't imagine, going through something like that. It's been, really hard. But you're right, me as a person, I need to figure out ways to overcome those feelings so that I can continue to do what I do.
Shifting more to the medical topics, because as I've said in the intro, if I have a medical question, there's only one person I'm going to. How has mesothelioma treatment evolved in the last 5 years since you joined Mesothelioma Guide?
Boy, when I first started, surgery was really, kind of at the forefront. And this surgery, for peritoneal patients, cytoreduction with HIPEC was kind of at its peak. And for pleural patients, the EPP, which, is removing the entire lung, was also performed much more readily than it is, 5 years later today. So it was really surgery, surgery, surgery. Get a surgical consult. That was always the first thing that we told patients. Something that I remember telling you, there is really only one FDA-approved treatment for mesothelioma, and that's chemotherapy. So surgery is still kind of considered experimental. Now, it's had great success. Obviously, if you can remove all of the cancer, right, that's going to give the patient certainly the best chance at beating it. Let's get it all out, and so that the body doesn't have to try to recognize it. Now I feel like the focus is kind of more on making mesothelioma more of a chronic illness, so that, or I should say a chronic illness rather than, an incurable cancer or something that, you're not going to be able to overcome. And that's so we can prolong, someone's life, extend someone's life expectancy. And I think that's where immunotherapy has really come into play. Immunotherapy was barely around when I first started. It was being, used for other cancers at that time, but certainly not thought of for mesothelioma. And now I think over the past 5 years, luckily, Meso has gotten some funding for research, and, scientists and doctors have been trying all of these treatment options together, right? The multimodal way of treating cancer is, let me give a patient chemotherapy, let me see if I can also include surgery, and then maybe do radiation at the end. Kind of putting all of these things that have shown a lot of promise. There hasn't been one smoking gun, which I wish there was for these patients, but doctors really are trying to figure out what they can do, not only to extend someone's, quality of life, but also that quality piece too. Immunotherapy has really been easier on patients than chemotherapy has, I should say, for most patients. Some patients still have a hard time just tolerating, anything toxic kind of going into their body. But most patients have said that immunotherapy was easier to tolerate. And that's kind of the new treatment. I know there are commercials for it for lung cancer. I'm sure you've seen the commercials for Keytruda. And now there's even commercials for Opdivo and Yervoy, which were just recently FDA approved for unresectable pleural meso. I know we wrote about that. So yeah, I would say surgery is still big, right? I do still suggest getting a surgical consult, but for those that maybe don't want to undergo surgery, or maybe they have a heart condition that doesn't allow them, or another comorbidity that, like diabetes, that maybe the doctor is concerned about their healing, right, after surgery. Now, instead of just chemotherapy, the patient has some more options, meaning immunotherapy or radiation or a combination. I think it was daunting for a lot of patients a few years back when they only had the option, of chemotherapy and then nothing after that, right? Like, well, what if chemotherapy doesn't work for me? What do we do next? And doctors didn't really have an answer. There are clinical trials, and there always have been, which I think are fantastic. There are ways to test out, drugs, but again, there's no guarantee with that. I do think clinical trials are an amazing resource for patients, since they can try something that, doctors feel really could work. It's just some people see that, as, well, it's still not going to work for me, so why try? But I think if we can make meso more of a chronic illness, right, rather than a fatal cancer, I think people's, maybe thoughts about it, or maybe it'll bring about some more hope or positivity, to people as they're going through this cancer journey.
There's also the tumor treating fields, which, kind of do the same thing. I've never made this correlation or analogy before, so please tell me if I'm wrong. I had a stepbrother who had diabetes. You talked about making mesothelioma more of a chronic or manageable illness. It's kind of in that mindset of diabetes. It's an illness that's there. There's no cure for it. You have your insulin pump. You watch your levels. You manage it. I don't know if HIV and AIDS are in the same realm. At one point, that was kind of, we don't really have a way to prevent it from being a fatal disease. I don't.
And now there are drugs for that at least help one, stop the spread, but also help halt the disease from, getting worse for somebody. And that's ideally what I'm, yes, saying. So your correlations are accurate. I'm saying let's make mesothelioma something that somebody can manage better on a day-to-day basis, rather than have that feeling of, oh my gosh, I'm going to, pass away soon.
Mm-hmm.
And I think, right, the tumor treating field, I think treatments are coming out that are less invasive. Tumor treating fields is the device that, you wear the electrodes on your chest. So it's really pretty painless. Sometimes a person, can have irritation on the skin from the patches, but other than that, it's working in a way that, the patient can still kind of go about their day to day and not feel so fatigued or debilitated, like with, let's say, radiation, for example. I know radiation has even evolved, with proton therapy now, which is a different using, a different form of radiation. It's protons, which allows, a patient's healthy tissue to not be as involved as before, where radiation 5 years ago, might have caused a lot of inflammation around the area of where the cancer was, which can cause, other unwanted side effects and things. So there is a lot of advancement in trying to keep the rest of the body healthy outside of where the cancer is. Absolutely. So it's really neat to see with research, what has advanced over the past 5 years. I know we want a cure, right? We want an answer. We want a smoking gun. We want that magic bullet. But I think we need to stop and look at all, right, the positive advancements that have come out of this that have helped patients live a bit longer, honestly.
And going back to finding that support, people reaching out to you, getting your recommendations or input into cancer centers, they go to their local oncologist who might not be experienced, and that may limit their treatment options compared to going to one of the top cancer centers in the world, where now, okay, the tumor treating fields device is an option if you can't have surgery. Immunotherapy is an option. They can enroll in a clinical trial. The advanced proton radiation therapy is an option that they may not have had if they went to their local hospital. It all kind of lends back to taking that proactive step to getting that next level treatment, to reaching out, doing your research, contacting someone like a patient advocate.
I think as, mesothelioma becomes more apparent, or, there's more research involved, I think a lot of doctors will become more knowledgeable. At least that's my hope, here in the future, so that you're right, a local oncologist can truly guide these patients to where they need to be. But if they don't, that's why we are here. And that's truly what we want to be for people. Take that step to reach out to us. I want to recommend what you can do to live the life that you want to live, and be there for your family, your grandchildren, whatever it may be. So yeah, providing hope, that's always our goal, right? That's what we try to impress upon people, that this may be an incurable cancer, but there is hope out there. So, and we're here to help and assist you.
The quality of life aspect, it's very connected to the treatment aspect and the prognosis aspect. In your role and how you've seen treatment evolve in the last 5 years, what does the quality of life discussion look like? And I know that that's a very vague question I just asked. A lot of different tangents. I mean, it's such an important aspect because...
It is.
Yeah,
and I wish,
go for it. Yeah.
I wish oncologists spoke about it more. Obviously their role is to provide, the best treatment options for people. But sometimes that discussion is not had, right? People just think, okay, I need to go, I need to take this treatment to fight this cancer without even thinking about the quality aspect. Gosh, that is something I can tell you that I do tell patients to talk to their oncologist about. You know, when they come to me and say, okay, my doctor recommended chemotherapy, but they didn't tell me what it would feel like, or, you know, if I was going to lose my hair, or what the side effects were going to be. So I will tell them, okay, you need to have the quality of life talk, you know, with your oncologist and say, hey, is this really the best treatment for me? You know, what about immunotherapy? Or what about switching from cisplatin to carboplatin because, you know, maybe my kidney function isn't 100%. You know, little things like that. I find that I need to have this conversation more with folks than it's, you know, said to me. And I find that's a lot of times, you know, in support groups or forums, you know, that I read, a lot of people ask about quality of life. What is, you know, so I think it's something that needs to be more apparent and talked about in medicine in general, honestly. I know you guys had a podcast about specialists that was doing a study on quality of life.
We did at Massachusetts General. They were measuring quality of life through the treatment program at the hospital, and also in the weeks after when, you know, your support program isn't as present on the level when you're going through treatment. And it was kind of looking at the emotional shifts that you go through, and it was really fascinating. But also just when you're in treatment, and again, quality of life and the effect it has on you from the physical, emotional, psychological standpoints, and those are often connected. Just having your conversations with people where you mention immunotherapy as an alternative or mentioning carboplatin, if they haven't spoken with you or another expert, they'll go into these conversations with their doctor completely blind, or it may never come up.
Exactly. And that's why, you know, you're a fantastic writer, and we create materials, right, for patients, loved ones, doctors even, you know, we want to educate as much as we can, so that when you do go to the doctor, you're right there with the knowledge level, right? And, you know, knowing what questions to ask, that's a big part, I think, of being able to extend your prognosis and really, you know, make educated decisions, is that, yeah, knowledge is power piece.
Is there anything else you wanted to say, whether it's about what you do at Mesothelioma Guide, the cancer in general, treatment for the cancer, something else we haven't touched on? I know we've touched on a lot. You know, it's kind of an open floor. I didn't know if there was any other really important piece of anything we've talked about or haven't talked about yet today.
I think we've really touched upon a lot, and everything that I wanted to get across. I am grateful that, you know, I could be here and we could have this discussion, so that if somebody is maybe a little hesitant to ask for assistance, you know, maybe they'll listen to our conversation and then realize, you know, why they should. Yeah, and I think a big thing for me, again, I'm going to stress it again, you know, is to not focus on statistics. It really will, I feel like, mentally almost debilitate you to where, you know, you're kind of not keeping that open mind, or maybe that slight optimism of, okay, well, maybe I can, you know, overcome this cancer, or at least have another 3 to 5 years rather than the 1 year. I can tell you, I've been helping this family since I first started here, and the sister just reached out to me to let me know that her sister, you know, is still battling her sarcomatoid pleural mesothelioma, which, you know, Devin, has a very poor prognosis, but she's on 5+ years, you know, has really tried quite a few treatment options. She's still wanting to fight and battle and be there, you know, for her family. So it's quite impressive, the endurance and strength and perseverance that cancer patients have. And I'm just happy that I can be there, as a sense of support or guidance or really whatever it may be, shoulder to cry on or just somebody, to listen. So I'm grateful that I have this opportunity to be there for patients and families and to help, educate you too.
Thank you. Last thing I'll say, you mentioned the statistics, and we oftentimes publish content and blogs that talk about statistics improving, the prognosis and life expectancy and the survival rates of this cancer. The best way for people to go above the statistics is to have that knowledge that we talked about, and that knowledge is power aspect. The statistics is not the knowledge you end on. You end on the specifics of what you can do in your individual case. Obviously, in your role, you are providing people with that knowledge as power, and hopefully in this conversation, we've done the same. Cancer patients and mesothelioma patients are so resilient if they have that knowledge. It's the best weapon they have in fighting this disease.
I totally agree.
Jenna Campagna, thank you so much. For everyone listening again, Jenna is the lead patient advocate and registered nurse for Mesothelioma Guide. She's been helping people affected by mesothelioma for 5 years and counting. Again, she's the person, if I ever need a question answered, or even if I wanted my theory validated, I'm 100% asking her. Everything I've learned is from her. Jenna, thank you so much for doing this, and I hope that the people listening, that it does empower them to reach out for help and ask for your help.
I really hope so too. Devin, thank you so much for having me. This was a wonderful opportunity for me to share my thoughts, and express to patients what I do, how I can help. So I'm glad that we were able to do this. Thank you.
And if you're listening and you'd like to reach out directly and contact Jenna, you can email her at jenna@mesothelioma.guide.com. That's jenna@mesothelioma.guide.com, all one word. Or you can contact her through the Mesothelioma Guide website. It's pretty easy to do through the website. Jenna, thank you so much, and everyone else who is listening, thank you. My name is Devin, and this is the Mesothelioma Guide podcast.